men die on average several years younger than women, a difference that previous studies have linked to the loss of Y chromosome in the white blood cells of men. This genetic change that occurs during life is called MLOY for mosaic loss of Y. It is very common and detected in at least 20% of 60-year-olds and 40% of 70-year-old men. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about the loss of Y chromosome and its adverse effects. Loss of the Y chromosome in blood cells of men is associated with disease and mortality, but no clear causal relationship has previously been identified. Now, researchers from Uppsala University show in an international study in the journal Science that loss of the Y chromosome in white blood cells causes development of fibrosis in the heart, impaired heart function, and death from cardiovascular diseases in men. The mouse models used in the study, the mouse Y chromosome was eliminated to mimic the human MLOY condition, and the researchers analyzed the direct consequences that this had. Examination of mice with MLOY showed an increased scarring of the heart known as fibrosis. The researchers saw that MLOY causes the fibrosis, which leads to a decline in heart functions. The researchers were also able to corroborate the causal effect in mouse via epidemiological studies in humans, where they found MLOY to be a new significant risk factor for death from cardiovascular diseases in men. These studies were performed using data from UK Biobank, a database with genomic and health information from 500,000 normally aging individuals aged 40 to 70 years at the start of the study. Men with MLOY in their blood at the start of the study displayed an approximately 30% increased risk of dying from heart failure and other types of cardiovascular disease during approximately 11 years of follow-up. The study describes for the first time a mechanism by which MLOY in blood causes disease in other organs and further identifies a possible treatment. It is shown that MLOY in a certain type of white blood cell in the heart of mice, so-called cardiac macrophages, stimulates a known signaling pathway that leads to increased fibrosis. When the researchers blocked this signaling pathway, the pathological changes in the heart caused by MLOY could be reversed. The link between MLOY and fibrosis is very interesting, especially given the new treatment strategies for heart failure, pulmonary fibrosis, and certain cancers that aim to counteract the onset of fibrosis. Men with MLOY could be a patient group that responded particularly well to such treatment, the researchers concluded. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.